In this episode, we are going to be discussing finances, but not just any finances. Finances that have to do with dental school debt and flatlining average dentist salary. And again, we have Dr. Craig Spodak here as our guest speaker, who will be discussing his experiences and giving us insight in this topic. And I'm sure we all have a lot to say about this. And whoever is watching this, hopefully it's a dental student or someone starting a new associate job, because this is really important information for you guys to consider. Now, I'm sure all of us probably know dental school is very expensive. We all graduated different times, but it's still a very expensive career. And the finances don't stop after graduation. They continue because of continuing education. And while at the same time, we're also trying to stay afloat and maintain our careers, make that salary, and make
and live.
more investments, live life. So, how do we manage that? How do you recommend, newer grads also, look at this perspective as something that is just starting in their career, and how can they manage it best?
Well, I think the first thing is that we go to school for a very long time. So most of our friends, when we leave them in college, they're already in the workforce, and we're going back in our first year of dental school. And so after 4 more years of school, you get out, and what do you want to do? You get your doctor, you're wearing a white coat, you're like, do what I did. I bought myself a Mercedes. Like, what other than like, I want to celebrate. I've been eating ramen noodles. Just having to have some fun here.
That's exactly what I did.
And it's because we've suffered so long. You're a student like till 27, 28 sometimes, maybe even later if you took some years off. So it just feels like you want to celebrate a little bit, and you are a doctor and you want to feel like a doctor. So we make a lot of poor financial decisions. And the thing that's happening from where I was when I went to school 150 years ago compared to when you guys are going is that the cost of dental school education is steadily moving up.
Right.
We know interest rates are going up. It's very this conversation is very pertinent because student loans are kicking back in, and everything's starting to happen right now. So when we look at that combined with the flatlining of dental salaries, like I was shocked to know the average dentist makes $180,000. So when we talk about our colleagues, or for anybody listening, that's a real thing. How do you know if you're going to be average or above average? I don't know. Right. And if you've never played tennis, do you think you're going to be above average or average? So let's just say for the sake of argument that you're likely to make $180,000. So the problem is that if you're taking on student debt of like 400, 500, 600 grand, compounding at 7-8%, maybe higher interest rates, is there a point that you guys want to talk about where you can say it does no longer make sense to do such a thing? And it hurts my heart to say that because I love dentistry so much. Yeah. But amount of money being spent in dentistry is rising, but it's going to like DSOs and stuff like that. And then you throw in
cost of living
and continuing education.
Yeah.
So I think that, it's, and I'm not gonna lie, if you're an average dentist, it's going to suck a little bit, but it is. Since I graduated with $420,000 worth of loan.
Okay.
And then right after I graduated in like June, July, and in September, I had a course that I paid $15,000. I put in a credit card and I went to it.
Right.
But once I got back from that course, I was able to do more dentistry. And then I went to another course, and since I graduated, I've been spending about $50,000 a year.
So how much have you spent in total?
In total, I graduated
after
in 2020,
graduation.
So $50,000 a year. So about $150K.
So yeah,
and that's like
we are investing in yourself.
But I said to myself, look, I'm gonna graduate. My first 5 years, I'm gonna live good. I'm not gonna live bad. I live in a nice place. I love what I do, But I live paycheck to paycheck. I'm not gonna lie. Yeah. When my money comes in, I pay all my credit cards.
Well, it's a normal thing at your age and your stage of your career.
Correct.
So I don't want you to feel bad about it.
I don't feel bad about it. I feel great because I have invested so much in myself. And a lot of young dentists, they think that they're just gonna get out, they're gonna start working, make some money. You're not really gonna make much if you don't know much,
Exactly.
So it's what I realized. In order for me to make not that 180. My first year, I did more than 180, you know, but I
Right, but
invested
you're-
a lot in myself.
I think
So
the
the
thing
drinks
that
are on you tonight. Then. Yeah, right.
no, not yet, not yet.
I think the thing that is so special about, and I appreciate what you said, because a lot of dentists need to hear that.
Yeah.
Because the Instagram era, like, you know, they see your life and they see all this stuff, and you're working hard. And like, if you were like, you're a thoroughbred racehorse, I'd bet all day on you. But I knew that about you, like, even before you graduated. I knew you through the oral surgeon, like Oscar is, you know, so you have this high deserve level. You're like, I'm going to crush it. Everything's going to come to me. Most people are not you. So I think we're doing a little bit of an injustice. Like, I don't think of myself as an average too. I always said, like, I can do something. I see the world. I don't learn through like deduction. I learn through like just modeling other people. Oh, Oscar did it. I'm going to be able to do that too. Like, most people are not wired that way. So we have to like talk to the average person that's listening. And it's a hard thing. I mean, if I could tell you that's the best 600 grand you've ever spent in your life, because I know what your future is. You know, we all know what your future is going to be. But what about the other person that doesn't have that? Like, how do we guide that person? When do we tell them?
And there's practitioners that come out of school and they go into a situation that they're working Medicaid and HMO offices like Barton and I did, right? You are not at 180 average.
First 5
You're
years.
well below that.
My first 3 years, 120, and then
Yeah.
after taxes, you're
Yeah.
80.
And it's 80. And then we're chiming in on that loan debt that even when I graduated back in 2009, which was 14 years ago, I still had $450,000 worth of loans.
And you were making like what, 120?
120 on a good day.
So let's
And
just
that's
hold,
pre-tax.
let's just hold there for a second. So you guys, let's just presume like 5 years. How long were you at that level for?
My first 3 years.
Yeah.
Okay,
four
so
years.
total opposite from Oscar, just total opposite. You
Yeah.
guys are
Yeah.
not average. You guys are well beyond average in desire and education, but we had $500,000 worth of debt, essentially making 120. Like, that's crazy.
Mhm.
That's crazy. Like, you could have started at Starbucks and worked for
Yeah,
5 years and at least been a
100%.
regional manager by a certain point. And I'm not kidding.
I had-
I'm not
I-
just talking shit. Like, no, but it's just
stuck to DJing.
well, I just wanted to talk about basic numbers. I mean, listen, there's a reason to do everything. Like, I talk to a lot of doctors, like, oh, I love having my specialist come in once a week. I'm like, cool. What do you pay the specialist? 45% or whatever, or 50%. I'm like, okay. Do you love skiing? Yeah, I love skiing. Do you love skiing more than you love having your specialist? Because they both cost you money. Like, you're both going to lose money on,
Right.
So we have at a certain point, a business requires a certain level of care. A business is like a helpless baby. You have to nurture the business.
Mhm.
And if you're running an inefficient practice and you have no money, it's a lot of stress. And I screwed it all up in a different way. So I had like a little bit of Oscar in me to say, like, screw it, I'm going to do it this way. I'm going to convince a bank to loan me, $6 million to build this building. No idea what the hell I was doing. And just almost drove it completely to the ground, and then had to learn too, just like you did. There was a certain point where, like, I'm screwing everything up. I got to learn something different. So you guys doubled down in the clinical. I doubled down on, like, can I do leadership? Can I do business training? I had to do that stuff. And that's why, like, I'm so passionate about the bulletproof practice, because we're trying to help all the people save from getting their asses kicked from all the stuff I had to deal with.
But to Oscar's point, though, I feel like when my career catapulted was when I decided to say, you know what, I know that I'm not doing as much because I am working at a lower level clinic at that time. And then I decided to take the leap, and I was like, I'm going to get into continuing education, and I don't care if I live paycheck to paycheck for a while. And I did that. And even though, it was hard on me at the time, because here I am, like 5 years out of school, and I'm like, I'm basically a dentist that's living on a paycheck to paycheck basis. But I'm going to focus on getting myself better so that then I could earn more in my future life and for my family. And that's what I did. I just went hard into it, but I did it later on, right? But then the proof is in the pudding. Years later, different story.
But
right?
there's multiple factors, because I have the unique privilege, and it's such a cool thing to know you guys for so long, specifically Alfredo and Oscar. Like, so you go through the clinical stuff,
Mhm.
and then the clinical stuff, but then you have to refine your leadership and your
Correct.
personality. You have to believe in your thing. Like, what Oscar always had is, like, even when you didn't know what the hell you were doing, you're like, dude, I got you, man. You're like, I like this guy. Yeah, I got the course done on Monday. It's Tuesday freaking morning. let's freaking go. So,
But that's when mentorship comes
Right.
into play.
So-
right?
That's true.
I had
and I
you.
feel lucky that I had you guys because since even before I graduated, like I was lucky enough to like
Yeah.
meet you guys.
Yeah.
And I know that like first, I'm like that because I remember you
Yeah.
looking at me like, bro, you just learned it yesterday. Like you want to try to.
So it's a good. I always say this, like dentistry and aviation. I'm a pilot as well. I'm a private pilot, and there's a saying in both. And I like to think of you with this. In dentistry, let's go. In dentistry, you start off with 2 bags: one full bag of luck and one empty bag of experience. And the goal is to fill the bag of experience before the bag of luck runs out.
Yeah.
And you, bro, did that. You went in there, you did the reps because we all had to learn
Yeah.
and we all made mistakes. You just had accelerated learning.
Yeah.
You accelerated mistakes, accelerated learning, you pivoted. You're a very unique guy. And I have so much respect and adoration for you, but I think it's doing a disservice to other people listening to say you could be like Oscar.
Yeah.
Like
But-
you're like we're talking to
It's
Michael
like
Jordan
mentorship
and
too, right?
and
So-
Serena Williams here. Like we don't want to say everybody's at the same level.
It takes
Yeah.
mentorship too, because I was privileged to know you 5 years, and my life has changed dramatically in that time period. I wish I would have met you maybe 10 years before that. Whereas I went through the mud, like Bart went through the
Yeah.
mud, and we went through the hard stuff, and we
I went
worked
through
in
quicksand.
trenches.
Yeah, I
In
think
the
I think
trenches.
99% of dental students or new associates don't
Yeah.
have that insight.
Yeah,
And so it really comes down to what vision you want for yourself
100%.
and how willing are you going to be to get yourself to
And
that.
knowing what you want, right? Because
Right.
I had my own practice for a few years that I was so unfulfilled and I was unhappy being a dentist. There was years that I wanted to quit the profession because I hated the day-to-day work that I was doing.
Me
Yeah.
too.
Wow.
Right?
Oh,
Me
wow.
too.
So powerful.
I hated
Me
it.
too.
And there was so many times where I would text some friends of mine that were in the same position that were classmates of mine. And we'd be like, man, don't you wish we would have just opened up that gym with the $450,000 that we had at the time?
Oh
But,
my
you know, and we had those thoughts, and I really, really, really disliked, and I was a very unhappy person for a very long time until I finally started doing what I loved. But it took a lot of stress. I sold the practice. I was driving from Miami to Tampa weekly in order to get that practice sold until I found an area where I was trying to do what I wanted to do. And ultimately, you have to know what your end result is and make sacrifices and risks that may not be to your benefit, but long term is going to make you a happy person. Because if I wouldn't have taken the risk of selling my practice, literally driving back and forth to Tampa every week for over a year until I was done, then I wouldn't have been where I'm at. I would have never have met
Yep.
Craig. I wouldn't have never met you. I wouldn't have been in this position to be able to speak freely in this podcast. So you have to be able to make risks, smart risks, in order to get to where you need to be in order for this profession to be fruitful.
No, and I think it
that.
has to do, like you mentioned, with mentorship and meeting the right people. And whenever, like, we talk about taking courses and continuing education, there's a lot out there. And
Yeah.
a lot of people take courses that are not what it should be. When I look at a course, I don't look at a there's 2 courses in dentistry. There is, this is what I do, this is my way, and then there's the science.
Mm,
I took the science. I took the courses that explained me the why I was doing the thing.
mhm.
And then when I took that amount of courses,
Yeah.
for example, I'm COIS, that's my thing.
Mhm.
I took COIS, and COIS taught me the why, how to do everything. Then from there, you told me to take, I took some connective tissue course, this and that, and then I ended up in FMR in New York.
In New York.
And FMR was an amazing course because it taught me how to do bigger cases in a simple way,
Mhm.
but I knew the why because I already had the back.
Mhm.
But you did it in the steps that I kind of told you to do.
Exactly.
Right? So there's fundamentals of learning. And I think you need to learn single tooth dentistry, how to do that perfectly, and then move forward. So taking the spears, the courses, eventually graduating into the FMRYCs, Aesthetic Advantage in New York, as well as doing an implant course, whether it's MISH or what other type of maxi courses, right? And then if you really want to dive into occlusion, there's Dawson, there's OVI, there's so many Hankey Institute, the Master Series. There's so many courses that you could take. And I think within that realm of the courses that we just aforementioned, it really builds your toolbox. And the more and more you learn, the better you are. But the key is don't just drink the Kool-Aid out of one person.
No, of course.
Learn what fits and learn what's good for you, and then what's good in your hands, practice that. What were you about to say, Dr. Barton?
So the biggest thing I think, and I'm an associate, we're associates, is when you graduate and you go to all these conferences, like, oh, so what do you work at? Do you own your practice? That's like the common denominator.
Sure.
And if you don't own your practice, you're a failure.
Yeah, there's a
You'd be
lot
like,
of shame.
oh,
I hear it all the time. I'm just an associate.
Yeah, I'm just an associate.
I'm just
Yeah.
like,
Yeah.
But for me, watching all my past owners, I never wanted that stress, especially after COVID.
Yeah.
It's like having that peace of mind. You need to figure out in life if you want to be an owner
Right.
and then drive yourself. Take the bulletproof classes, take whatever classes you need to know to master the business. But then you got to step back clinically, like how Craig does, like so eloquently. It's like you come in and you know how to manage behind the scenes and motivate us, and then you know to step behind clinically. And it's just like you give us, you assist us, and then we go in and we just.
But even as an associate, Bulletproof has been amazing.
Yeah.
Right? Because there's so many sidetracks and courses, and just listening to the ability of where you can go and listening to other people's stories and just being around them, that's like life altering, right? So, and within that, you build a core group of mentorship just by meeting people, right?
Yeah.
So, because you could be an associate in a practice, luckily like ours, where we're earning more than some owners are.
Yeah, I want to just add. I just kind of want to double click on that. What he just said is really important because I have the unique purview of seeing like 150 mastermind clients that I've worked with, 150 dental practices the last 3 years, and I go through their P&Ls. And more often than not, like 85% of the time, I tell these doctors after I look at their P&L, "Do you love owning your business?" And they said, "Yeah, why?" I'm like, "Because you'd be better off working for somebody and getting 30% of your collections. You'd make more money."
Mm-hmm.
So I love the idea, and I feel bad about the shame of I'm just an associate, because it's cool. It's in one way that the practice owner, their retirement and their wage and their salary is connected in one specific building. As an associate, for those that are, you can make good money and you can own and diversify your retirement strategy. You don't have to be a business owner in your own business, but you can own a commercial piece of real estate. Or if you own Amazon stock, you're a business owner,
Sure.
investing in the S&P. So I love the idea that you can deleverage your wage and your salary from your retirement strategy and diversify it. One of the things that keeps most owners up at night is consolidation. If a tornado rolls through that building, I screwed my retirement and I screwed my salary.
Well, there's
and
no
everything else.
passive income. And I think that's something that you have taught me is in dentistry, where I find the most successful dentists that I've met through Bulletproof or in my courses is dentists that have then been able to invest and been able to make passive income outside, even in any business.
Yeah,
right?
you can invest in the practice you work in, which is kind of cool because you have insider information, but that's okay if you don't, as long as you are a business owner, meaning own stocks, own real estate, something passive. The one thing that I learned, and it took me till 52 to like really see it clearly, is the amazing effect of compounding interest. I know it's super freaking boring, so I won't occupy too much, but like you buy this, I'm looking around Miami, and I've been coming to Miami for 40 years since I was a kid, and like seeing this little tire shop, like the Firestone tire shop, and that guy probably worked his ass off, fixing tires, but probably making not very much money. And one day, 20 years later, his building is worth $20 million. So it's like fitness and investing, it's like just steady, slow things. Getting wealthy is not fast and sexy. It's actually slow and boring.
I think this is an amazing segue, because our next topic is going to be about dental practice, entrepreneurship, and building a business as a dentist. So stay tuned for our next episode. We're going to be speaking all about it.
All right, awesome. Thank you.
There you go.